Hi, I'm Amy at Missouri Cancer Associates. I'm one of the nurses at the infusion room. I am going to walk you through how to disconnect a chemo pump and take the needle out at home. So to start with, you want to make sure you have all your supplies together. We're going to send you home with a little bag full of everything that you need. You'll need gloves to minimize your exposure to the chemotherapy itself. You'll have 2 different flushes to flush the chemotherapy through and prep the Port-a-Cath for removing the needle, and then also an alcohol swab and a Band-Aid. So we'll go through all of these supplies and how to use them. First of all, you'll want to wash your hands before you do anything. The pump, when it finishes, will be red like this. It'll say that this stops. It will say that it has stopped. It will say that the reservoir volume is 0. Pump stopped. So this means it's empty and done. When that happens, you will clamp this clamp right here closest to the patient. It's a yellow clamp. You just push it. If you're unable to remove it quite away, if the caregiver is not home at that time, you can leave it for a few hours even before you would remove it if that's what you need. And that's what the alarm will sound like when it finishes. If you hit the silence button, it's snooze, just like that happened, and then do it just now, and then acknowledge will shut it up completely. If it keeps beeping or is persistent, you can flip the battery on, or batteries out right here, and it will turn off completely. You'll undo the safety pin and undo this tape. Okay. You'll push the saline syringe in and then spin and flush that in. Okay. Then you'll repeat the same thing with the yellow syringe of heparin. You'll push, spin, and then flush that in. When you're done with that part, then you're ready to take the needle out. If you could please put a cap on the end of the tubing, that'll keep all this chemo that's left in the tubing from coming out later and making a mess and limit your exposure to it. So cap that up, and you'll put that aside to bring back to us when you come back for your next appointment. So what you do to remove the dressing, you hold a finger down on the port itself to keep it stable while you pull the dressing up all the way around the sides. Okay, and then you'll use 2 fingers or a finger and a thumb to hold down the white edges of the Port-a-Cath close, flush to the patient's chest. Then use a finger to stick it in there and pull the needle out until it clicks. You want to make sure you hear that needle, that click, because that engages the safety device in order to keep it from poking you or us when you bring it back to us. If you don't have a sharps container at home, you want to put that back in this bag and bring it back to us, and we'll dispose of it for you. If you do have a sharps container, just toss it in there. A Band-Aid might be needed if there's a little bleeding. It's not uncommon for there to be some bleeding because it does a needle poke into the skin. So just a Band-Aid, but don't leave it on for any more than 24 hours at the most because of the risk for infection. So that is it. If you have any questions, you can always call. Thanks.